Here it hurts a little.
Here in the front? Okay.
Like this part.
Okay. It's going to make a vibration, but you're also going to be able to hear it, not just feel it. And I want you to tell me which option sounds louder. So I'm going to give you two. Go ahead and just take a couple of measurements here. Hi, Marianne. How are you?
Hi, how are you?
I'm good. So I read in your chart that you had a little bit of an accident.
Yes, I fell off the stairs and I hit a hit on my head. So.
Okay, so you hit your head. And have you had any symptoms ever since?
Yes, I've been feeling dizzy and a lot of headaches.
Okay. When did this happen?
2 days ago.
Okay. Did you take anything for the pain?
Not though.
Not no. Okay. Okay. So I'm gonna be taking a look at you. We want to make sure there's no repercussions from that where you hit your head. I'm just going to update a little bit of your medical history so I have all your information accurate. Can you confirm your date of birth for me, please?
Yes, March 12th, 1998.
Okay. Do you take any medication regularly?
No, nothing.
Do you exercise regularly?
Yes, I do Pilates and box.
Okay. Do you smoke?
No.
Have you ever smoked in the past 10 years?
Yes, like 2 times.
Okay. Oh, but
But
okay.
like,
That's good. Not regularly, right?
not regular. Mm-hmm.
Okay. Do you drink alcohol?
Yes, I drink alcohol.
Socially or?
Socially.
Yeah. How many drinks a month would you say?
I think 4.
4. Okay. Okay. Do you by any chance know your weight and height?
Yeah, hi, I'm like 5'5".
Okay.
And weight kilograms is okay.
Yeah.
I'm 62 kilograms.
Okay. Okay. So I'm gonna go ahead and start just taking your vital signs, and then I'm gonna do a very thorough examination. Just gonna put on my gloves before I start. Okay, so just go ahead and relax. I'm going to start just taking the temperature. Okay, I'm going to take to an ear reading. Okay, temperature is normal. be using this arm to take your blood pressure. Just gonna go ahead and there you go. Okay, so now it's 110/60. Just going to slide this out. Okay, so I'm just going to start examining your face. I'm going to be palpating, so just expect my touch. You can just go ahead and relax, okay? Okay, so I know you pointed on this side when you said you hit your head. Can you just tell me exactly where you...
Here in the back.
Okay. Have you noticed any swelling since, or...
No, just
really?
like a bump.
Okay. Yeah, it seems like just a little bump, but it's not. Is it painful when I touch?
A little.
A little bit. Okay. Just going to make sure there's no other injury. Pressing very lightly just to make sure there's no fluid retention. And that the blood is irrigating normally. I'm also looking for a symmetry right here. Just making sure there's no swelling or drooping on either side. I'll be palpating the head. If you feel any other spot where it hurts, let me know.
Okay.
Okay, go ahead and try to shrug your shoulders. We're just gonna lift them. Does that hurt?
No.
Okay. Okay, now go ahead and try to sit straight as you can, just making sure there's no deviation here. Okay, now try to touch your left shoulder with your head. So you're just gonna go to the side, to the shoulder right here. Okay, now this side. Is that painful at all?
Just a little like here.
Okay. Does it feel like pain or just a little bit of a stretch on the...
Like pain when I'm stretching.
Okay. Go ahead and go back to neutral. You can just rest. There you go. Okay, I'm just going to do some very light movements on your joints, just making sure you don't have any other injuries. If at any point you feel any pain, go ahead and let me know. Go ahead and rest. Okay, I'm going to look at this side.
There it hurts a little.
Here in the front? Okay.
Like this part.
Okay. Okay, let's do some movements and try to see which one hurts. Okay. So I'm just checking the elbow. Any pain there?
No.
Okay. Will we do that
Yes.
a little bit?
A little.
Okay. Going to like this. And let's try to. Does that hurt?
A little.
Okay. Now we're going to try like this. Does that hurt?
Yes.
Okay, let's just try to move the elbow there. Do you feel pain on the shoulder?
Yes, in the shoulder.
Okay. Okay, so there might be just some strain on your tendons here too. There's definitely no fracture. You wouldn't be able to move it. Did you notice your shoulder was a little bit sore, or you had not noticed?
I hadn't noticed.
Okay. Okay, if you were to rate the pain from 0 to 10, what 10 being like the most painful thing you can imagine?
I think like a 6.
6. Okay, so it is. Okay, we might need to take an x-ray here just to take a look at the joint and rule out any injuries. My guess is just sore from the fall. Maybe you hyperextended it. Okay. So now I'm going to start just doing a few tests. We're basically testing all your senses, which relate to all your cranial nerves. And we're going to start with your sight. First, I'm just going to take a look at your pupils. So if you were to just look straight ahead. Okay. Okay, dilation and constriction looks pretty normal. So, no concerns there. Now I'm going to give you this Snellen chart. You can just go ahead and hold it at arm's length and go ahead and cover. You're going to hold it with your right and with the left. Go ahead and cover your left eye. There we go. Okay, so do you see all the rows in there? Do they seem clear or are they blurry?
No, I see them all.
Okay, go ahead and tell me this last one.
LTFPH.
Okay, we're going to read this one starting on the right.
JHDFC.
Okay. Now we're going to switch sides. Okay, can you go ahead and read me this one starting on the left?
Yes. CFDHJ.
Okay, and now this one starting on the right.
HBFTL.
Okay, that's very good. Now I'm going to be testing your eye reflexes. Okay, so I want you to just follow my fingers with your eyes. Don't move your head, just the eyes, okay? Okay, very good. I didn't see any skipping of the movement, was very steady. Now you're gonna go ahead and look straight at my nose. I'm gonna be moving my fingers into your field of vision. Just let me know when you see them, okay? Do you see them there?
Kind of.
Okay, how about here?
No.
Okay. Do you see them? Okay. Just let me know when you see them. Say no. Okay. Do you see them there?
Yes. No. There.
Okay. Do you see them?
Yes. No.
Okay.
There.
Okay. Your peripheral vision is really, really good. Now I'm gonna be doing similar thing, just going out and just tell me when you don't see them, okay?
I don't see them.
Okay.
There.
Okay.
I don't see them.
Okay.
There.
Okay. So now you're gonna keep on looking straight up my nose. I'm going to be moving either the left or the right, and just with your peripheral vision, let me know which ones are moving. Okay.
Okay. Left. Right. Left. Both. Both.
Okay.
Left. Both.
Okay.
Both. Left. Right.
Okay. Very good. Okay. Now I'm going to be taking a look inside your eyes. Just trying to look for any scratches on the retina. Yeah, very well it is here. So just gotta look straight. Just gonna gently hold. Go ahead and look up. I'm going to be taking a look inside your ears, so just go ahead and turn your head. You did mention you've been feeling dizzy, right?
Yes.
So we just want to make sure there's no damage to your ear. The back membrane looks pearl-gray and normal. No redness or swelling. A little bit of redness, but nothing really concerning here. Okay, I'm going to do a hearing test. So I want you to close your eyes. I'm going to be making a sound either on your right side, left side. Just let me know which one sounds, to which ear it sounds closer.
Right. Left. Right. Left. 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 Right.
Okay, now I want you to tell me how many times you hear the sound. So this would be 1, 2, 3. Okay.
2, 3. 1, 2, 3. 1, 3, 2.
Okay. Okay, now I'm gonna do another hearing test. You can keep your eyes closed. I'm going to be placing this close to your ear. This is a tuning fork. It's going to make a vibration, but you're also going to be able to hear it, not just feel it. And I want you to tell me which option sounds louder. So I'm going to give you 2. This is option 1, and this is option 2. Which one was louder?
The second.
Okay. Option 1, option 2.
2.
Okay. Now I'm going to place it right here on the top of your head and let me know if you hear it symmetrically.
Yes.
Yeah. Okay. I'm going to do that one more time.
Yes.
Okay, very good. Okay, now I'm just going to be tapping very lightly on your face. Just let me know if you feel any pain. I'm just checking for some reflexes. Just go ahead and relax your jaw. And go ahead and just take a couple of measurements here. lift your head a tiny bit. I'm just going to take a look inside your nose. So everything seems clear. Have you noticed any trouble breathing, anything like that? Okay. Now we're going to do a smell test. I'm going to give you a few different smells and just let me know if you can identify what it is.
Okay. Like detergent.
Okay. Some of them might be a little bit more pungent, so just
It smells like a little like lime.
one. Okay. Inhale.
Like lavender.
Okay, now I'm going to ask you to cover your right nostril. Okay. Go ahead and take a deep breath. Good.
Like mint.
Mint. Okay. And now we're going to cover the other side. Go ahead and inhale.
That smells also like mint.
Like that. Okay. So those were not all right, but let's see how the rest of the tests come back and we'll determine if that might be a problem or not. Have you had any flu-like symptoms in the past couple of weeks? Stuffy nose?
Stuffy nose.
Okay. Okay, now we're going to take a look inside your mouth. And we're going to do a taste test. So just go ahead and open. Go ahead and say, ah. Go ahead and stick the tongue out a little bit. Ah. Okay, very good. Now, go ahead and try to, I'm going to place my tongue depressor right here. So go ahead and try to push it with the tongue. Okay, and this side. Muscle tone is normal. Okay, so now we're going to do a taste test. I'm going to be placing this little strip of paper on your tongue. Just go ahead and let me know if it tastes like something to you. Nothing.
Nothing.
Nothing. Okay. It might taste like nothing. It might taste salty or sweet. Or
Salty.
salty. Okay.
A little sour.
Sour. Okay. And this is the last 1.
Nothing.
Nothing. Okay. Okay, now we're going to do a few movements on your face. I'm going to ask you to do a few different things. So just go ahead and close your eyes. I want you to go ahead and try to clench your jaw. Try to bite hard. Clench. There you go. Okay, masseter muscle is symmetrical on both sides. The muscle tone is normal. Now go ahead and give me a big smile. Okay. Okay, now you're gonna try to raise your eyebrows. Okay. Now go ahead and try to frown the eyebrows. Okay, so just try to keep them frown. Okay, that's pretty good. I'm gonna place my hand right here. Try to push it with your head. Okay, now try turning but sideways. So you're gonna try to look to the back and try to push my hand. There you go. Okay, here. Okay, to the side. Okay. Muscle tone is normal, so okay, so check your taste. Normal. Smell was a little bit altered. Eyes, reflexes. Good. Your side was 20/20. Hearing normal. Okay. Okay, so I'm gonna give you this. You're just gonna breathe out. Okay, relax. Now breathe. Inhale. Breathe out. Okay, I'm gonna make some adjustments here. Okay, one more time. Inhale. Breathe out. Okay, one more time. Inhale. Breathe out. Okay. Okay, Marianne, I'm gonna give you a patient gown. I want you to change into this. It's just gonna give us an opportunity to check your back, your lungs, chest, heart. Okay, so I'm just gonna start taking a more detailed look at your head. First, I'm just having you turn your head this way. I'm gonna check the area where you bumped. Okay, I see a little bump, but even the redness is starting to dissipate, so it seems to be healing on its own. A little spot right here. So this doesn't really seem to be related to the fall, but I do want to go ahead and take a sample of that little spot. Okay, so first we're going to be doing a sharp or dull test. We're using two different sensations. I'm just going to give you a sample of what it feels like. Do you feel that sharp?
Sharp.
Yeah.
Mm-hmm.
And do you feel this dull?
Dull.
Okay. Did you feel that at all?
Yes, sharp.
Okay.
Sharp. Sharp.
Okay.
Dull. How did it feel? Dull.
Dull, okay.
Sharp.
Okay.
Sharp.
Okay. Okay, I'm just going to be parting the hair here. Okay, so now I'm going to be pressing with 1 or 2 pressure points at once. So I'm just going to show you. This is 1 pressure point, and then now I'm pressing on 2 different spots at the same time, okay? You can just go ahead and say 1 or 2.
1, 2. 1, 2.
Okay, just gonna do another part right here. And we continue the same 1 or 2.
1, 2. 2. 1.
Okay. And just 1 more. Okay, so that's 1. Okay.
2. 1, 2.
Okay. Okay, now we're going to do 2 different objects. This one's hard. Yeah, this one is, sorry, this one is soft. Do you feel the difference?
Yes.
Okay.
Soft. Hard. Hard. Soft.
Okay. To do other section.
Hard. Soft.
Okay.
Hard. Soft.
Okay, very good. Okay, now I'm gonna have you turn your face towards this side. I can go ahead and fix your hair a little bit. There you go. Just so it doesn't tickle you in the face. Okay, so we're gonna do a few of the same tests, but now we're gonna do them on your face. Okay, so I'm gonna start with the sharp or dull sensation. Okay.
Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp.
do either 1 or 2 pressure points.
1, 2, 1, 2, 1, 2, 2, 1, 1, 1, 2, 1, 1, 2.
Okay, now I want you to tell me if this feels cold or warm.
Cold. Warm. Cold. Warm. Cold. Cold. Warm. Warm. Cold. 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 Warm.
Okay. Okay, now we're going to do the same hard or soft.
Hard. Soft. 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 Hard. Hard. Soft. 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 Hard. Hard.
Okay. Okay, so that all looks normal. I'm just going to listen to your lungs, your chest, your abdomen a little bit and make sure that's all normal too, okay? Okay, so I'm just gonna listen to your heart. I'm just going to can hear S1 and S2, no S3, no S4. Now I'm going to listen to your lungs. I'm going to have you take a deep breath in, exhale. Okay. Place this right here. Okay, another deep inhale. Exhale. Okay. I'll be placing this right here on the side. Deep inhale. Exhale. Same thing here. Deep inhale. Exhale. Okay. So now I'm just going to listen to your abdomen. Okay. Okay, so that was all very normal. I'm just going to palpate a tiny bit. Just making sure the abdomen is and not painful. Okay, very good. Okay, Mariana, I'm just going to have you turn on your belly. And we're going to take a look at the back. Okay, I'm just going to open the gown. Okay, I'm just looking at the alignment here. We have a little bit decreased curvature right at the cervical spine. That's very common nowadays, but I can recommend some stretches for that. Okay, I'm going to tap very lightly. Let me know if this hurts at all. Okay. Any pain there? Okay. Okay. I'm going to do a very mild adjustment on your spine. Okay, it's just a very mild misalignment. That's probably just due to the fall, but it's super minor. So that should correct on itself. I'm going to close this and close the gown. And I'm just going to let you get back dressed and we can discuss the results once you're ready.